Hey everyone! Did you know that a couple thousand people requested for this acute care survival tip sheet? That is amazing. That just shows that you guys are not alone and you are taking the steps to get ahead and prepare for your acute care fieldwork placement, or to start, because some of you guys are actually working as an occupational therapist already or an assistant. And it just shows that this is such a serious topic, and I'm really happy that I was able to make this for you guys so that you will be able to feel more confident and be able to walk in through those hospital doors and know what you're doing. There's a lot of information out there, and I'm happy that you decided today to stop and watch this about 10-minute video on what it is that you need to do to pretty much survive and thrive in an acute care setting. My name is Anabellecanty. I've been an occupational therapist since 2011, and I remember I was there with you. I thought I was prepared, thought I had all figured out. I walked in through those hospital doors and I was like, holy, what am I getting myself into? I'm following this lead OT, 300 beds, and I even had to teach adaptive equipment on my very first week. So I'm not sure if that's going to happen for you, but at least with this tip sheet, the survival tip sheet, you will know what to do because you will be prepared and ahead, and know what to expect. So I just want to let you know that recently I found out that there are occupational therapy students and occupational therapy assistant students who are failing their level 1 and level 2 fieldwork placements, and that's just mind-blowing to me. No one should fail their fieldwork experiences, and sometimes it's over something so little and it just breaks my heart. I was struggling back in 2008, and I don't know why people are still struggling now. It's 2020. So you know what? I decided to make this for you guys so that we could have more successful, passionate, and prepared therapists out there, especially in the acute care setting. Because once you can get this down and survive, then you will be able to work in any other setting. Trust me, because acute care is very fast paced. So let's get to it. This section has pretty much two separate sections. One section talks about the benefits of preparing yourself for acute care setting, and the middle part is 8 tips, and then under each tip talks about key points that you should focus on, and pretty much it's the meat and potatoes of this, so very important. I will pretty much right now talk about each section just to give a brief overview, but I actually have an acute care course that I will dive into more detail, and I'll tell you more about that later on. And I also have a few photos here just so you can start visualizing and just getting mentally prepared for this. And so let's get started. So the very first tip that you want to do is know the role of OT in an acute care setting. So we work in many different settings, and it's important to know your frames of references and just know exactly what we do. In the acute care setting, it's more of a collaborative approach. So just know that we're ancillary. So we're supporting the medical professionals, and we're going to do a lot of communicating. So just know your role. What I do here in acute care, you see this hospital is behind me, is way different than what I do in outpatient. And knowing the difference and finding that niche will definitely help you survive. So you are not going to research everything. You'll have it fine-tuned and know the basics. So know your role of OT in the acute care setting. And you could even look at job descriptions too, just to give you a heads up. And also, number 2, research the type of hospital you will be at. So please believe all hospitals are not made the same. So right behind me is a community hospital where I see joint replacements, pretty much scheduled surgeries, and a bunch of UTIs and pneumonias, a geriatric type of hospital. But my other hospital that I work at, that's about 15 miles down, is a level 2 trauma, where we see gunshot victims, motor vehicle accidents, post-ops, craniotomies, heart surgery. So very different settings. So if you're going to start your field work somewhere in a more community-based hospital, just focus on those diagnoses. Or if you're at a level 2 trauma, you know, okay, I need to really hunker down and know that I need to understand all of these different diagnoses. And usually your fieldwork coordinator or your next mentor will let you know if you speak with them ahead of time on what type of population that you will serve. So very important to know what type of hospital you're in so you will not overwhelm yourself, and that is the way to survive. Just know what you need to know right now, and the rest will come later. Number 3 is safety and also equipment. Just making sure that at the end of the day in acute care, it's all about safety and independence with basic ADLs. So making sure that they are safe. So really know your lab values, your vitals, heart rate, oxygen saturation. Very important to know that. So get comfortable. You can watch YouTube videos, ask fellow colleagues. When you're in your labs, just really focus on what type of monitors and equipment that you're using. Really get familiar with blood pressure monitors as well. And also the various types of beds, an ICU bed versus a regular bed. So just get familiar, and you could easily get a hold of that online and ask your clinical instructors. And also equipment that the hospital will have. Just make sure that you know that you're going to be working with a walker, a hemi walker, a single point cane, crutches, different types of lifts like a Serosteti, and know that you also have medical equipment that'll help the patients get out of bed. Sometimes you have lift techs where they have the Serosteti and they can help with the mechanical lifts. So don't feel like you have to know exactly everything, but just know you will have certain types of medical equipment that will help the patients get out of bed. It'll help you out, it'll help the patient out. It's just a win-win situation. And another one is know your environment. So really understand the type of environment you're at in terms of personal protective equipment. We call it PPE. Pretty much a mask, what type of mask you're going to be using. You know, we use a lot of the procedural mask, goggles to cover your face. Know what types of different isolation rooms there are, like contact precautions, enteric precautions, airborne precautions, where you'll use different types of mask and a gown and things like that. It's just get a brief overview of that. Don't get too much into detail, because you won't survive if you know, getting all caught up in all the details with that. But just know that there's different types of precautions and different types of masks and goggles that you can use for the patient. So really just know your environment, and also know all the members of the hospital team in that environment that can help you. Know that, you know, the different doctors, the surgeons, the PAs, the NPs, I know all these acronyms, right? And also know there's CNAs, you know, because they can really help you, especially when you start seeing patients by yourself. It's really good collaboration. So really, that's very important to know your environment, and that also ties into safety and things like that. So also, get ready for chart reviews. I mean, chart reviews for days. In the acute care setting, we do a lot of chart reviews because ultimately we need to get their history and profile and make sure that they are safe to be seen. So I don't know, we're all from different countries right now, different states. Our system uses Cerner. I know Epic, Meditech, Kasamba. So there's a lot of different electronic platforms. You don't have to know all of it, but just know that there are different types, and just hacking it and kind of mastering it the first week will definitely help you. Because if you're efficient with chart reviews and understanding what tabs to look at, it could help you prioritize your schedule, which is very important too. Triaging and prioritizing, that will also help you with your productivity, which I will talk to you a little bit more. And like I mentioned in my acute care course that I will be launching soon, I talk about really the details on what tabs to look at, case study scenarios, everything to help you prep. But in a general sense, just know that there are different platforms, know how to prioritize your list, and ultimately the chart reviewing is helping you understand whether or not you should see that patient or not. And also communicate effectively with your succinct documentation, right? And using those really smart and Roomba goals, of course, that you guys know about. So chart review. So you'll feel like you're chart reviewing more than seeing a patient, and that's absolutely normal with acute care setting. So also obtain all your rehab resources. So don't reinvent the wheel. You know, in order to survive and thrive, get all the information that you can get. Get all the precaution sheets, the protocols of the surgeries, even the OT toolkit. You already know about that. So see if you can get access to that. You know, usually you have to pay, but if you can get it at your hospital and download it onto your USB It'll help you build your toolkit so you can use it for your patients and for yourself to prep for your board exams later. For me, I got all my resources, and it would really help me prep for my exams, and also help me with my future treatments. So yeah, get all of it. I was one of those. Now it's all electronic, so you just get a flash drive or email it to yourself when you're on the floors. If you can, you have to get permission for that. And also, very important, keep open lines of communication. So I know it's very intimidating, but all of this presentations that you're doing in school, really, it's really prepping you for the acute care setting, because you are going to be communicating like there's no tomorrow. If you are intimidated with communicating to nurses and various interdisciplinary and multidisciplinary staff, start off communicating with your coworkers or your colleagues, or start off communicating with your mentor, and really advocate for yourself on what you feel is safe and good for the patient, and also for your own competencies. If you're not comfortable with something, advocate. And once you can advocate to, your clinical instructor, you'll be able to advocate to the doctors. And believe it or not, in order to survive in a hospital, you got to be able to communicate to everybody and work as a team, because everyone's working together to help the patient be safe and independent, not only with their self-cares and getting up out of bed, but just to get back into the community. So we're all working as a team. So you can't work as a team if you can't communicate. So you have to communicate. And so whatever you're doing, all of this virtual stuff and presenting all the time, it's really for your benefit. I was shy at first, but at the end, I was able to communicate, and it comes more natural. So that's a really, really good tip. And communicating will also help you collaborate with the physical therapist and all the rehab teams, so you can collaborate and co-treat and help these patients safely, so you don't feel like you're all alone. That's the worst feeling. In order to survive and thrive in an acute care setting, you can't feel all alone. You have to communicate, and remember, safety is number one. And like I mentioned earlier, productivity is also, I know that no one likes to hear about productivity and clinical competencies, but productivity is very important, especially with the hospital systems now. Students are having productivity, and usually, I don't know how it is in your hospital setting, but by the time you're done with your fieldwork, you should be seeing at least 8 to 10 patients a day. So just be mentally prepared for that. It's either you're seeing 8 to 10 patients per day, or you're probably going to see like 24 units billed. And if you need more information on that, I talk more about that in the course, units, all that stuff. But productivity, I know, is very important. So also, you could ask your clinical instructor that too in the beginning. What are my productivity demands? So you can mentally prep yourself. And everything ties into the productivity. If you know your role, if you know what type of hospital you're at, what the type of patients you're serving, if you know what type of equipment you could use, if you can also know your environment and know, how to chart review efficiently, and getting all the resources and communicating, it'll ultimately help you with your productivity, because you'll be more efficient, you'll be more confident if you're able to gather everything together and apply it every day. I know it's so much work. It's like, productivity. But you know what? Acute care is very fun. I created this tip sheet. I know it's a word heavy. That's why I decided to give you a video. And this topic is so hot. Like I had to make this video for you guys, so you guys know who I am, of course, and kind of get a visual sense of what to expect and how to survive and thrive. I've been working in the hospital setting since 2008 as a rehab aide. I worked my way up to be an OT, and I love it. I love mentoring students. I love helping. It's my mission to help all of you guys survive and thrive. And it really breaks my heart seeing that students are failing over something so little. So we're not going to fail today. You guys are here. You're not failing. You guys are going to do it. You guys are going to do great. And you will feel more confident, and you will step through those doors and say, hey, I'm ready. I also, because I'm feeling, very thankful that you guys are here, and I was reading all of your comments, thank you all. I'm blessed to help all of you. I'm going to also mention, be comfortable. Everyone's like, oh, what kind of scrubs I should use? It all depends on what your hospital requires you to wear. But right now, look, I'm wearing a lab coat, to hide all my, you know, my pens and everything. And get some good comfortable shoes. You know, I prefer leather tops, so if something spills you could just wipe it off, especially with COVID going on. I also have this headband. I was recommended to wear the headband because in order to survive physically, you know, you don't want to hurt your ears with this around your ears all the time. So this one actually has a button that you could connect the mask with, so I could protect my ears. So a lot of people are also wearing head wraps for the males. You could wrap your ear parts of the mask with your goggles, because some hospitals require you to wear goggles too. So just be comfortable, you know. And like I mentioned earlier, because this topic is so hot and there's thousands of people recommending for this sheet that you have in your hand, I decided, you know, I'm going to make an acute care survival tip course. And because you guys are watching me all the way to the very end of this 15-minute video, I thought it was 10 minutes, but you know what, why not give you more information? Hit subscribe and you guys will have access to my acute care course first before it launches to the general public next month in January. And when you hit subscribe, comment below and tell me what exactly you want on the acute care survival course, and I will add that in. I'm gonna pretty much go over these 8 tips, but more into detail, more into case study scenarios, and talk about experiences that I had, my students had. None of my students failed. Other OTs, students have failed, but none of mine have failed, and I want all of you guys to pass. So yeah, subscribe today and I will have your list, and I'll be able to give you access to some of the other courses that I have too. And yeah, so exciting. I know, sorry I went over, but it was really nice to meet all of you guys. So yes, print it out, bring it with you. If you're OCD, put it on your phone. It easily pops up on your phone as a PDF, even colored. So yeah, you'll have it with you because it's hard to remember everything. Okay, thank you guys. Nice meeting all of you. I can't wait to meet all of you guys soon. Okay, so look out for my emails and subscribe so you'll be able to have access to my course. Okay, bye-bye.